Well, good morning, everyone, and good afternoon for those of you on the East Coast, and welcome to the call. This is the weekly Doctor's Clinic call. We do every Tuesday at noon Eastern, 11 Central Time here in North Dakota, where I'm at. And I get the pleasure of picking the topic every week. And this morning actually last night, I started thinking about what am I going to talk about today? What's the topic of today? What do we really need to talk about? And I thought, what a great time to talk about the importance of really health maintenance. What can you do to maintain your health? So many people, they come to me as a doctor, they go to their clinic, they go to their regular GP, and their question is, what can I do because I've got this or I've got that? Or even worse yet, they go to the doctor for their regular physical, they go there for their checkup, and the doctor says, sit down, we've got something we need to talk about. And that's what DW and I were talking about last week was, you get those words where the doctor sits you down and says, we need to talk about something. And so I thought today we'll spend some time talking a little bit about the importance of maintaining your health. What can you do more as a prevention? What can you do really to really keep costs down? And before I bring a couple of guests on, the one thing that I wanted to share is that a number of years ago they started talking about how they were going to save healthcare costs in the United States. We were going to do this, we were going to do that to save healthcare costs in the United States. And they brought up the subject of universal healthcare coverage. And, and I'm not going to get into politics or anything like that. I'm just going to talk strictly about financial, right? If you take a look at it, and I don't know if my numbers are correct. These were the numbers from a few years back, but they said that 80% of your healthcare dollars, 80% of the healthcare dollars that we spend in the United States is spent in the last 2 weeks of your life. Think about that. 80% of the money that we spend in the United States on healthcare is spent in the last 2 weeks that a person is alive. And so when they started talking about universal health care, and they said, we're gonna make it so that it's more affordable for diabetics to get their medication. We're gonna make it more affordable so that people on high blood pressure and that can have cheaper medication. We're gonna make it so that people can go to the doctor and get checkups and I thought, well, how in the world is that going to really save any money? I mean, we're talking about making universal health care available for everybody during the time when they really only spend 20% of their health care dollars. So you tell me, and I'm not a math wizard or anything like that. Maybe you are, but think about it. If I'm going to save money, wouldn't I want to go after the 80%, right, rather than the 20%? And I mean, think about that. Think about that. And we talk about how, the other countries in the world have universal health care. Well, you know what they also have is they have a system that pays for prevention. And that's where they're really saving money. They're not saving money because they allow people to go to the hospital because they're sick. They've developed a system of helping people understand the importance of maintaining their health before they ever get sick. And you look at United States. I mean, I knew some people from France a number of years back, and they said, well, the reason you guys are all so sick is because you eat all that Franken food, right? Frankenstein food. We're not eating the food that God put on earth the way that God put it here. We're eating food that these food giants, and I'm not going to pick on anyone in particular, but these food giants have developed these foods that really, they taste so good, and they've got food additives added to them that actually make you crave more food. And the reason that they do that is because that's where they make their money, by selling you food. They're not making their money because they sell you nutritious food. They make their money by selling you more food. And so back in the 60s, 50s and 60s, they had developed this sugar from corn syrup, and the Crystal Sugar and all the big sugar manufacturers, they were scared because they're like, oh, we're going to lose our market. We're going to lose our market. We're going to lose the market share that we've developed on selling people sugar, right? And what they found is that these food giants all got together and they said, well, let's not substitute in for the sugar. Let's just take and add the high fructose corn syrup, or fructose syrup, or corn syrup, or corn sugar, whatever they want to call it today, and let's add this to new foods, and let's increase the demand for sugar. And a number of years ago, I bought a stack of Life magazines and Time magazines at an auction sale, and I was paging through these magazines from the 50s and 60s and early 70s, and it's interesting. There's ads in there, and I remember these ads when I was growing up. There was ads, showing a guy kicking sand in the face of a smaller man on the beach, and the big muscle man, what are you going to do about it? And the ad was basically, you want to eat more sugar, right? You want to get bigger, eat more sugar. So I look at those ads and I think, you wouldn't want to run that ad today. I mean, we eat so much sugar. The average person consumes about 150 pounds of sugar annually in the United States, and that's a lot of sugar, and so that causes a problem, and that brings us to one of the latest creations from Sisel, from Tom Maurer, which is the AGE pill, the age pill, anti-glycation, because when you sugarcoat something, when you sugarcoat a muscle, when you sugarcoat a protein, it's called glycation. And so this age pill is really, when you think about it, a lot of people, I'm seeing a lot of great testimonials on Facebook, and people are emailing me testimonials, and I'm hearing people talk about it on the calls, and everybody's talking about, the testimonials of the great results that they're having taken this to clear up some symptoms that they've had. But really, in my opinion, the best testimonials that we're going to hear are the ones we're actually never going to hear. The people that they got rid of the glycation before it turned into a problem, the person that didn't have the stroke, the person that didn't have the cancer, the person that didn't have the major chronic disease. And so that's what I really love about it. And I'm thrilled to see the testimonials. I really tell people the best testimonial that you're ever going to hear is the one you're actually never going to hear. And that's so cool, because we've actually done some real prevention that way. And they've shown, I was talking to my friend and one of my business partners down in Australia, and she was talking about, the article in Life magazine, or Time magazine, talks about, reversing the aging process in mice. That's all we need, is to have healthy, longer living mice, right? But mice, they can use experiments on them, and they can see what it does in humans. So it really is beneficial, even though we don't necessarily want to have mice that live a long time. So I just wanted to talk a little bit about that and get into our subject of today, which is really the subject of real prevention. What can you do? And then I've got my friend Miriam on the call. And she's going to share with us, she's got a lot of years of knowledge of taking products as a prevention. And really, as she's going to share, she still ended up having a chronic disease. But like I told her, I said, just think about how much younger that would have hit had you not been taking things. Think about the other diseases that you might have had, or maybe worse yet, think about the fact that maybe you wouldn't have made it to this point in your life to actually contract a chronic disease of older age. And so those are things that we really have to start thinking about, because if you're doing prevention and you still end up with something wrong, you just have to start wondering what would have gone wrong had I not been doing prevention. And so first I'm going to bring my friend Andrea McKinney from up in Michigan. Andrea, are you there?
I'm here.
Hey, I know that you're really politically involved, and we don't want to get into politics or anything like that. But, when they started talking about universal health care and bringing health care to the masses, did you ever think about that? That how are they going to save money if we're only addressing 20% of the money?
Well, I did, actually, because I was a health insurance agent. And over the last 15 years, I wondered how in the world they were going to cover all the expense of the baby boomers moving into their late years. So, yeah, I spent a lot of time thinking about that.
Right?
But,
and it's not just the baby boomers either, right?
No, actually, I can't remember the name of it, but the second generation down has, due to baby boomers, dying off, they have exceeded in population the baby boomer generation at this point.
Right.
So those are the people we need to reach and teach about preventative care now.
Right, and as Sisel's kind of going through a rebranding right now. We're rebranding. We're having a new look. Everybody will see it in September. We're going to have a new look to our a lot of the different things, and I can't tell you some of the things that I know, but I'll just say you're going to love it. And what we're doing is we're trying to appeal to that younger generation, and really as we look at the younger generation, I mean, we start talking about things like Alzheimer's and Parkinson's. Andrea, you've got kids. Do you have grandkids?
I have 9 grandchildren.
Oh wow, I didn't know that. You're so young. I didn't think that you had grandchildren.
Surprise.
But you think about it with the grandkids and your kids. If you start talking about Alzheimer's and Parkinson's, do they even seem worried about it?
Oh, no, well, not so much. I think probably I have 3 children in their 30s, and so, they've been exposed to people having severe illnesses, so they probably think about it. But, looking back on my own life, I think I just wish when my children were growing up that I had the knowledge I have today about nutrition and the importance of supplements in the diet and stuff. It would have been completely different for my own children. And, I have to look back and go, what did I set them up for, So now we have to work on correction.
Right, yeah. Now, here we are. We're sitting there worried about it. But, you take a look at, like, you and I and really the baby boomers, I mean, when we were kids, for the most part, we didn't grow up with all the processed foods that the generations below us, have grown up with, right?
Not at all. Everybody had real butter on their table. I mean, my grandmother had a dairy farm. I drank real milk at her house.
Oh yeah, whole milk.
When I look back at it and
raw
think
whole
about
milk,
it,
right?
Yeah, farm whole milk. When you just walk around a grocery store nowadays, and I do this every once in a while. Like I don't buy a whole lot of groceries other than fresh produce, but I'll just pay attention to what people are throwing in their carts sometimes, and it just amazes me and appalls me all at the same time. I'm like, really? That's what you're going to buy with your money to feed your family?
Right? And, I had liver and onions for breakfast this morning. What do you think of that?
Sounds good.
It was elk liver, too. I when I went out elk hunting, the liver was right there, and I thought, somebody said that's supposed to be really good, so I grabbed it, and I decided to have some this morning, and it's supposed to be really, organ meat's supposed to be really good for you.
Right, especially if you get that wild kind.
Right? But Andrea, the thing is, I do that too. I watch people in the grocery stores, and when I'm shopping, I pretty much walk around the outside edges of the grocery store. That's where all the fresh food is. And I don't know if you ever noticed that, but and then all the processed food is in the middle where most people are walking with their carts, but I'm along the outside grabbing the fresh food, and then I have to go in and grab some dog food in the middle, but, pretty much everything else on the outside.
Right. Yeah. I hardly ever shop in the middle.
Yeah.
And
Yeah,
recently I've seen stuff where you should feed your dogs raw meats. I mean, that's what they would eat in the wild, right? They're saying they're healthier if you get them raw meats now than the processed dog food.
Yeah. Yeah, the dog food companies probably don't want you to say that, but whatever, right?
All right.
But if you make that recommendation, did you know that in some states, then now you're practicing veterinary medicine, they can actually throw you in jail just for what you just said.
Isn't that exciting?
But that's the whole thing about our country. We've developed a country where we try and convince people that processed food is somehow safer and better and all that, and it's really not. And so we start getting into the topic of prevention, right? And fresh fruits and vegetables are still on top of the list rather than buying canned or frozen or processed. And I remember when like yourself, I grew up. My mom and dad had a huge garden, and that's where we got all our vegetables when we were kids. And then my mom would can a lot of things so that we had fresh vegetables in the winter, so that we had enough food.
Yeah, I see a movement going back to that with the younger generation. A lot of young people in their 30s are growing gardens and buying organic, and some of the word is getting out, so that's good.
Yeah, it's getting out there, but it's funny in that you watch those same people that are buying organic. I'm not going to mention the name because she might be on the call, but she's always telling me how everything she does is organic this, organic that. She won't eat this, she won't eat that, and then I was noticing the products that she sells in her hair salon. And I said, well, that has sodium lauryl sulfate in it. And well, yeah, but that's what they sell. That's what they sell, she said. And I said, so you use that? And she said, well, yeah. And I said, well, what about your other products and things like that? So, I mean, if we're going to really get into talking about prevention, don't we have to look at not just what we put in our body, but what we put on it?
Oh, exactly.
Yeah,
and I think we've covered that before, that so many people are unaware of their skin exposure to different substances and what it does to the body.
Yep. And it's equally as important, maybe even more important than the whole subject of food, right? Because people are more aware of what they put in their body, but they don't even realize that, hey, that shampoo that you just put on your head, in 26 seconds you can measure those toxins in your urine.
Yeah, that's amazing, isn't it?
It really is.
Look at all the medications that have come out that they use in like patch form. They just put it on your body. I mean, 30 years ago, nobody would have believed that you could put some patch for medication on your body and have it be effective because we didn't have an understanding of that.
Oh, I remember in my clinic I was using some natural patches back 20 years ago, and at the time, the science was kind of laughing at that, saying, you think you can get medication, you think you can get nutrition into the body by putting it on the skin, and we were using like different kinds of oils, like emu oil and things like that, to actually transfer it from the outside to the inside.
Uh-huh.
And now you see them using hormone patches and things like this, and now they have a patch for quitting smoking. And I know you're familiar with quitting smoking. A little bit. I'm going to let you just kind of say a little bit about what you do, what your kind of your regular job is, right? Tell us a little bit about quitting smoking.
Oh, well, I've never been a smoker, but I had 3 adult children who were, and when I lived in Florida, someone mentioned to me that they had been treated with laser to quit smoking, and it worked. And I went, what? I never heard of that. This was about 2008 8 or 9, and so I thought when I came back up to Michigan to visit that, they'd be all over. So I Googled it to see where the nearest clinic was, because I decided that was going to be my Christmas present to myself, to go get my 3 kids laser to stop smoking. And I discovered there was only one clinic in the whole state of Michigan, which was the satellite of the original clinic that started in Canada. So I made the appointment, took my kids down. We did like a group session on a Sunday afternoon, and they all got lasered to stop smoking. I stayed in contact with the person who ran that clinic for the last few years, and she decided to start franchising her clinic and sent out a letter that, anybody that knew anyone in town, a chiropractor or someone like that who might want to set up a laser treatment center for to stop nicotine addiction, she was interested in talking to them. Well, it ended up that the chiropractor I talked to here locally didn't want to actually buy into her program, but he would rent her a room. So we set up a satellite office here last year. So I've been doing laser treatment. I trained as the technician, and I've been doing laser treatment for people. I had 3 customers yesterday who were lasered to stop their nicotine addiction. And that I'm, really happy that I'm involved in that, because I lost my dad to not lung cancer or anything like that, but something that was just as horrendous at the end of his life due to smoking. So, it's a good feeling to help people change their lifestyle.
Well, and Tom talks about it as well. Tom Sr., he talks about it as well, that, next to smoking, the toxins from the personal care products are probably the worst thing that you can do in your life. As far as, like, the laser clinic and that, for somebody who, if we're talking about prevention, we got to talk about quitting smoking. What's the success rate of using laser for stopping smoking?
She really hasn't figured out her success rate, or if she has, she hasn't shared it with me. When people ask us, like, what's my guarantee or what's your success rate, we tell them, a whole lot of it depends on them, because it really does. It's a comprehensive program. We give them many tools to help. It's not like you just get lasered. There are many other tools that we have available for them that is in this whole program. And ultimately, though, it comes down to we're assisting them psychologically, assisting them with the biology of it, and then it's totally up to them. So we can't really predict that.
Yeah, and I don't remember because, right before my motorcycle accident 10 years ago, I had just started a laser quit smoking program in my clinic, and so I don't remember the percentage either, but it really was high. But, we were talking earlier, you and I were talking about, as far as prevention goes, because that's our topic today, is that what things do you feel are important to add as far as nutrition goes? If somebody's been a smoker and they quit, what things do you think are important after they quit?
Well, we know that most of your vitamins are depleted if you're a smoker. The body has an amazing way to recover once you've stopped smoking. It's a process, just like anything. But, talking about Sisel products, I would imagine the Triangle of Life would be excellent products to actually restore the chemistry and the nutritional needs of the body that are depleted when you're a smoker.
I agree with that, too. The Triangle of Life is so important because the fucoidan gets rid of inflammation. And if you look, every single chronic health problem has inflammation as one of the components of it. And then you look at Eternity, with the resveratrol, it switches on the sirtuin gene, which is the gene of youthfulness, and smoking ages the cells because of oxidation. And then you have the Spectromax, which, supplies all those nutrients. And when you look at what smoking does, smoking provides toxins in your body. And if you understand toxicity, what toxins do is they displace nutrients, and they substitute themselves where the nutrients used to go. So when you start getting rid of that, now you're going to need those extra nutrients. And I kind of simplified that, but that's really what it is. And then the Spectromax also has 40 great antioxidants, all plant-based, and so your body can put them to work right away. The other product that I really like with Quit Smoking is our Super Omega Plus, because it's got all the omegas again, which help with inflammation, and it helps with getting all of that to the cells and getting rid of any kind of toxins that way. And then it's got the CoQ10 in it as well. And CoQ10 is an enzyme that you need for the cardiovascular system. And really, if you're paying any attention to the medical news right now, they're saying that our country is depleted of CoQ10. And most supplements actually doesn't deliver CoQ10. It actually has something else. It's like CoQ10 in some ways, I suppose. You could call it CoQ9 is what it really is. But they sell it as CoQ10. And nobody knows any better. Nobody really pays much attention to it. But that's where Tom and I were talking a couple of years ago, and he said, we use the actual best form of CoQ10, so it doesn't convert to CoQ9. I don't know if you knew that.
I don't, but I do know that Tom quarantines his products and uses high quality, and everything is tested to meet his standards and regulations, and I really appreciate that about Sisel.
Yeah, that's exactly it. And somebody might look at it and they go, "Oh, I can go get a fish oil at Walmart for a lot less." Yeah. If you knew what you were getting at Walmart, you probably wouldn't be buying that. But that's what people say. So you do pay for quality, and that's important to know. So on the topic of prevention, I'm kind of watching the clock here, so we stay on time. Talking about the topic of prevention, Andrea, just stay on the line. But I'm going to bring Miriam. If you could hit *6. Miriam is a friend of mine out of California, and she's done just really an excellent job over the years of making sure she takes the right nutrition and doing things so she's really stayed pretty healthy. Miriam, are you there?
Yes, I'm here, Kurt.
Yeah. Well, I appreciate
Can you hear me?
getting on the. Yeah, I can hear you loud and clear.
Okay.
I appreciate you getting on the call and sharing. Tell us a little bit over the years, how long ago did you actually get started taking nutritional products?
Actually, in 1968, a neighbor came over and said, "Are you sick and tired of being sick and tired?" And I said, I didn't know I had an option. And he introduced me to Shackley, and then he introduced me to a man who wrote a book called Own Your Own Body. And I liked the title so much. His name was Stan Melstrom. I used the title more than anything of that book because it was he believed in eating dandelions and all kinds of weird stuff, and that was too weird for me. But
so
it put me on that path.
Yul Gibbons, right? Remember him?
Yeah, it put me on that path. So as you said, I always looked for quality supplements. I did Shackley, I did Nature's Sunshine. I didn't do much of the business, and I like signed up one person or two people, and the one lady became good in another marketing company. And oh, okay. But I stayed with that all these years, looking at herbs and supplements and just looking for ways to prevent problems.
Yeah, and that really is the key, isn't it? As you've gone through your life, and I know you're just a couple of years older than me. As you've gone through your life, I mean, you've probably noticed that the people that you knew who didn't do any prevention, they probably ended up with some serious health issues, right?
A lot, yeah, a lot. And I worked with several people who had serious health conditions that desperately tried to recoup from getting, my brother-in-law had some form of cancer, and we worked with him for 4 years before he died. And my sister, who wasn't married to him, but her sister-in-law to him, saw that, and she came back to me this year and said, can we order some of that stuff for me now?
Yeah.
So she's in her 60s, I'm 71. So,
yeah.
But yeah, prevention has been, the big thing was I got diagnosed with Parkinson's in 2014. So I thought, well, what the heck, how'd that happen? And then I realized, well, now I still have some options. I still have some, I still can look for answers, which is how I met with Dr. Kurt, because he says, let me answer your questions. And so that was very helpful. I appreciate that very much.
Well, thank you. Yeah. You know, and Miriam, like you and I were talking about earlier this morning, I mean, the key thing is that, I mean, you think about it, you ended up with Parkinson's, even with all the prevention that you've been doing since 1968. I mean, think about that. That's, 68. That's almost 50 years ago,
Almost 50
right?
years, yep. Because I know what year it was because my oldest child was born in 68, and we lived next door to these people Well, we stayed in touch because of Shackley, because he signed me up as a Shackley distributor. So
yeah,
but,
Royal Shackley was a very intelligent man himself.
Yeah, and he believed in the basic H, which was the soap that you put on your body that would go in your body. So that whole philosophy is not new to me.
Right.
But I heard Paul Zane Pilzer speak at a convention, and he said exactly what you said earlier, was that the chip industry, their goal is to take a 200-pound woman and make her into a 250-pound woman. Is to make the chips taste so good that they can't stop eating them.
Right.
And my husband has always had a little challenge with his weight since he's about kindergarten. And he told me if you don't bring it in the house, it'll help me because I won't eat it. So I was doing good diet program. What's the one where you go to? I can't even think right now, but the diet program said to clean out all your cupboards of all this stuff. And so once I did that, I couldn't bring myself to filling it back up with the crap. So it's kind of when Paul Zane Pilsner said that 10, 15 years ago, that resonated with me right away.
Oh,
I was thinking of the Weight Watchers program.
And speaking of Paul Zane Pilsner, I mean, he was a world-renowned economist. He wasn't a nutritionalist at all.
Right.
And he was an economist. He actually worked for
That's right.
How many different presidents?
At least 3 or 4. At the time, that was back then. He was an advisor to them on economy, and that was one of the issues, was they're making money by supplying these products that people can't stop eating.
Yeah. So the food companies are providing products that we can't stop eating so they can make money. Then the drug companies are trying to come up with a medicine that will make your brain think that you're skinny so that you don't get sick, but yet you'll be fat. So now the food companies can continue to sell you food, and the drug companies will sell you a pill that will make your brain think you're skinny, but you're not. What do you think of that?
Oh, that's interesting. I hadn't heard that one.
and that's what they're working on. Like I read a number of years ago, I think it was 2 years ago, they were working on a drug that would trick your brain into thinking that you had good, healthy probiotics in your gut when really you didn't.
I just had another thought, was this H pill, the AGE pill rather, is going in there and cleaning out all the sludge that we've all this stuff has been put into our system all these years. So there's going to be a little repercussion when we open those trap doors and start letting that dirt out. It's going to be a little bit of a response from the body saying, help!
Yeah.
You're hurting me.
And that's why we need more good, clean water, right?
Yeah. Yeah. Drink a lot of water.
Andrea, do you have any questions for Miriam? Maybe we lost Andrea. Anyhow, Miriam, any thoughts that you want to share? I know we got to end the call here so we can get people back to their working day. Anything that you want to add as far as like that you've learned over the years, the 50 years that you've been involved with nutrition?
I guess the biggest thought is that prevention is the key. As you started off with, prevention is the key, because the less you do to destroy your body, the better it's going to do you and last you, and better you're going to feel. And I think my biggest mistake was, I was thinking I didn't tell this to my kids, but I'm wrong. All 3 of my oldest daughters I have 4 daughters, the 3 older ones are able to do network marketing, and they got involved in other companies, but they're all in the health-related field. Better nutrition, better exercise. When you said that Sisel is trying to reach the younger generation, that's important because my girls said, "Oh, this is for old people." When you look at Sisel, they didn't like the packaging, didn't like this, they didn't like that, and I thought, huh. So I'm glad that Sisel realized that they need to address those issues because that's a whole lot of people.
Oh, wait till you see the rebranding. I haven't seen it yet, but I just know based on what I've heard that it's going to be really, really nice.
Well, that's exciting.
Yeah.
Exciting.
Well, thanks, Andrea, and thanks, Miriam, for sharing today. I really appreciate that. This half hour really goes by fast when you have a hot topic to talk about. And it's really getting the information out there that's so important. And when we talk about Sisel, we've got so much information to share. We could sit here and we could talk for probably the next 2 weeks, couldn't we?
Yeah, so. I just muted you.
Okay.
Yeah, well, we could go on and on every time.
Yeah,
every time I call you to ask you a question, I bend your ear for as long as I can, and then I realize you've got to get back to work.
Yeah, everybody's got things to do. So thanks again, and thanks everyone for listening to the call. Thanks everyone for sharing the recording with other people and getting the word out that we can do something about it. You can prevent. You don't have to wait until your doctor says, sit down, we got something to talk about. Because, really the key to it, in my opinion, is the cure is don't get sick. Don't get sick in the first place, and then you don't have to worry about finding a cure. All right, everyone. Thanks for joining us on the call. I'm gonna hang up here and get the recording out. It'll be on siseldoctorclinic.com, and it'll be posted on the recording website on Facebook as well. So have a great day, everyone. Bye-bye.
Thank you.